are concerns that government may miss the population immunity target set for 2022. It's due to the current slow pace of COVID-19 vaccinations. To date, South Africa has administered just over 9 million COVID-19 vaccines. Gauteng leads the pack with over 2 million vaccines administered. Meanwhile, the Department of Health is concerned that misinformation is said to be playing a major role in vaccine hesitancy, while Professor Hannelie Meyer, the head of the South African Vaccination and Immunisation Centre at the Sefako Makgatho Health Sciences University, joins me now. Professor Meyer, good evening to you and thanks for your time. It's been quite concerning the rate at which the rollout of vaccines has slowed down. Your analysis of what's leading to this?
There are a number of factors, actually. And as you have indeed mentioned, I mean, vaccine hesitancy is one of them. But vaccine hesitancy, is determined by a number of factors as well. So it could be people's perception about, am I at risk enough to go to the vaccination site to get my vaccine now? Do I have access to the vaccine? Is it easy for me to get there? And what we have seen, for example, with the elderly people, they might not be able to get to the site. So, it's not convenient for them to get to the site. So access, is definitely one of the factors. But then there's also a lot of misinformation being spread, and that leads to vaccine hesitancy. And I don't know whether you know, with the last Newzroom survey, they've actually shown that vaccine hesitancy is decreased. So people are more willing compared to previous surveys to actually go for the vaccines. But that, intention doesn't always translate into action. So yes, that is a concern.
Professor Meyer, a lot of the studies that have been conducted on why some people are reluctant to take the vaccine seems to stem quite largely and have its roots in misinformation, as you're saying earlier. It really points to a failure to communicate on the part of our health services at a community level and really be able to address the concerns that people might have about this vaccine. So if the first-hand information is coming through from messages forwarded on WhatsApp, it becomes difficult for government to come back and correct some of those misconceptions.
Yes, indeed. Misinformation is really a huge problem. And it actually needs to be addressed more like at an individual level, where each and every person needs to make an effort to absolutely stop spreading the misinformation. Because, the more we are sharing information, so I always tell people, absolutely don't share anything, any misinformation. Rather share good and reputable information and actually vaccinate people with the, good and correct information to give them confidence. So yes, so confidence also plays a very big, very important role. So people need to have confidence in the system, confidence in the leaders, and then obviously get the right information. And as you said, so a lot of, now we are going to vaccinate, open up for the younger generation, and they are the ones having more access, I would say, moving more in the social media space. So that is quite a concern for me, if we, to see, and we've seen also from the Newzroom survey that the younger ones are actually more hesitant compared to the older generation. But I mean, there could be various reasons for that as well. And one of the major concerns that people have is actually the safety of the vaccines and then the efficacy of the vaccines. So that would always come up as, the first sort of answer when you ask them, so why don't you want to take the vaccine?
These concerns that you're raising are issues that we have known even from, last year when the development of the vaccine was being expedited. Do you think that a lot more could have been done to again be communicating and be educating people about these vaccines, because clearly whatever has been done to date has not been sufficient.
Yes, so I think we need to give them more, even statistics. I mean, the statistics are out on the website. But for example, I mean, with the development of the vaccines, the two vaccines that we are using in South Africa, I mean, there were more than 45,000 participants in the clinical phase 3 trials. So by the time we were rolling out the vaccines across the world, we already had lots of data about the known short-term side effects. And now, since December, we've already vaccinated more than 2.33 billion people across the world. So the chances that there will be, or the likelihood that there will be, a lot of very rare events presenting themselves with now suddenly is highly unlikely. So, and I think these kind of things need to be communicated to people, and so that they can understand, what are the effects and what do we need to expect and how rare is the possibility of experiencing these very rare effects, because they only present in once you vaccinate millions of people, because they would present maybe 1 in a million people. But seeing that we've already had vaccinated more than 2.3 billion people, it shows you just how safe and how effective are these vaccines. So what people also need to know is, now that we are moving ahead, is actually long COVID. So there's about 10% of people experiencing long COVID, where they have these long-lasting effects of tiredness, loss of memory, they can't concentrate, depression. And for those things, we don't know how long are they going to last, and how are we going to manage them. So, all these kind of things need to be communicated to people. And from SAPRA's side, there will be a microsite launched now very shortly, hopefully around next week, where all these adverse events will be shared with people so that they can actually see what is happening and that the vaccines are safe. Because they hear about one event, or maybe somebody has died, and then they don't understand what happened. They just assume because something happened, it happened, because it happened after the vaccination, it happened because of the vaccination. So that's a huge misconception.
Yeah. What is the danger for us as a country, Professor Meyer, if we are unable to reach our vaccine targets?
It is the only way that we are actually going to, get hold of this pandemic, is if we can, as quickly as possible, vaccinate, as many people as possible. I mean, if we can vaccinate, say, 80% of the population, it means that every 4 out of 5 people getting into contact with someone who's infected will be protected. So, the more people we have vaccinated, the fewer people there are, who's actually susceptible to the disease, and the fewer the chance then of this virus spreading. And then also, then we won't be facing all these variants, because the more you spread the virus, the more opportunities there are for the virus to actually mutate. And then we sit with new variants, and we don't know whether the vaccines will be working. But at the moment, the vaccines that we have in South Africa is working very well against the variants that we are facing at the moment. But yes, so the only way to do it is to get people to go and get vaccinated, spread the good news, help others to get to the sites, stop spreading misinformation,